Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Edo State government says COVID-19 cases in the state are abating with no infections or fatalities recorded in the last 24 hours. Jigawa government provides support, farm input for farmers whose activities have been impacted by the pandemic. And official of the World Health Organization says Europe is entering possible endgame to the COVID-19 pandemic. Thank you for joining us. There have now been nearly 11 million COVID-19 cases and over 239,000 lives sadly lost in Africa due to the coronavirus pandemic. However, new cases and deaths have declined overall for the third consecutive week on the continent. According to the WHO Africa Regional Director, Dr. Matshidiso Moeti, vaccination remains our best defense against severe illness, death, and overwhelmed health systems. To date, he says Africa has received more than 587 million doses of the COVID-19 vaccines. And so far, only 11% of the African population is fully vaccinated. A troubling 85% have not received a single dose. According to her, if African countries are to reach the 70% vaccine coverage target for their citizens by mid-year, they need to increase the pace of rollout sixfold. She further adds that the WHO in the African region is partnering with UNICEF and others to join forces to urgently ramp up support to countries to enable them overcome the bottlenecks, improve coordination, and speed up vaccination efforts. But let's now bring you the latest updates from Nigeria's cases last night.
65 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 6 states and the FCT. That's a drop from the figures reported earlier. Lagos accounted for the highest number of cases with 19 infections. Kano had 16, Rivers 12, while 11 cases were registered in the FCT. Kaduna, Niger, and Delta logged a single-digit infection. The total confirmed cases in Nigeria now stands at 253,405. The report also includes a backlog of confirmed cases from Niger State as well as 0 cases from Nasarawa, Sokoto, and Zamfara states. 26 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 229,676. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,136. Currently, there are 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission with over 17,000 positive samples, followed by the FCT and Edo State. Over 15.3 million of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 5.7 million of the population have been fully vaccinated. In Africa, over 10.8 million persons have tested positive, while over 240,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 384 million, while deaths are now beyond 5.7 million.
And the Executive Director of the National Primary Healthcare Development Agency and his team are continuing review meetings and conversations on COVID-19 vaccination rollout across the country as part of strategies to address vaccine hesitancy and also improve COVID-19 childhood vaccination coverage. Well, this time in Edo State, the southeast zone, Dr. Schreib says that to achieve herd immunity and return to normalcy, everyone needs to get vaccinated. He met with the 17 local government area chairman in Enugu State under the auspices of the Task Force on Immunization, also appreciated the state government for their leadership and provision in immunization and primary health care. Meanwhile, at that event, the Chairman Senate Committee on Primary Healthcare, Senator Otazie Chukwuka, also renewed calls for everyone to get vaccinated against COVID-19 to stop community spread of the disease. Meanwhile, the Edo State government says it has been making advances to climb out of the current fourth wave of the coronavirus pandemic. The state is among the top 7 states with confirmed cases of COVID-19 since the pandemic started. Now, the lead risk communication pillar of Edo COVID-19 response team also confirms that the figures in the last 24 hours shows that the cases are reducing. He adds that vaccination is key, while the non-pharmaceutical protocols are still very much in place.
We're in the fourth wave, and that fourth wave kicked off around December 2021 and is still on as we speak. However, a lot of progress has been made. The rate of infection has been reducing very rapidly. Speaking about the last 24 hours, for example, about 215 samples were collected across the different hospitals where they handle COVID situations in the state. And of the 215 cases, for example, today, none of the cases turned out to be positive. And, you know, we've had one discharge from the hospital today. And then in the whole state, as we speak, we have only 12 active cases. And in the last 24 hours, no deaths. So case positivity is 0, death is 0. That gives you an indication that there's some ray of light at the end of the tunnel, and we are gradually climbing out of the, you know, devastating crisis caused by COVID-19, not just in Edo State, but across the country. First thing we want everyone to do is to ensure they take advantage of the vaccination exercise that is still ongoing in the state and across the country, you know, because that is the silver bullet. When you get the first dose, the second dose, and then possibly the booster dose, you know, chances are that you are very high chances that you're protected from death from the disease. Then apart from that, yes, all other non-pharmaceutical interventions such as frequent hand wash and so on and so forth will also be very useful at this time. We believe that COVID has come to stay, and we're all supposed to try and live with the disease, but we must live with the disease as much as possible, maintaining these safe habits so that we would eventually eradicate the disease from our population.
Women farmers have lamented the effect of the COVID-19 pandemic in their farming activities. According to the farmers in Jigawa, they have recorded huge losses and are yet to recover. Our correspondent Sadiq Liasu has more.
For many of these women here, surviving the impact of COVID-19 pandemic has been tough. They are Jigawa women whose farming activities have been greatly affected by measures put in place to curb the spread of the virus.
We really suffered as a result of the pandemic. During the lockdown, we found it difficult to get fuel to pump water for our farmlands. Also, we could not sell our products as markets were asked to close.
However, the visit of the state government to their community is sound of music to their ears. They are being provided support to alleviate the struggles for which they seem grateful.
They lost everything to COVID-19. And then some of them, even those that are rearing animals, they lost to COVID-19 because they could not even go to the market to sell their animals. We are just beginning to see the favor from the government, and I'm sure the government is going to continue to support us.
While on the field, I discovered that most of these women were going through a lot during that period. They could not farm, and it was shortly after the flood that destroyed their farmland. And you know, the government was overwhelmed by a lot of responsibility for getting the women, rural women farmers, which are the SWAFOM members. And we discovered that some of them actually are in need of help.
While these bags of fertilizers and food milling machine will go a long way to alleviate the plight of these farmers, They hope the state government will extend this package to others across the state to bring a major boost to their economy. Sadiq Ilyasu, Channels Television News.
Well, mild side effects such as fatigue, headaches, chills, slight fever and pain or numbness at the site of vaccination may occur and disappear within a day or two. According to the National Primary Healthcare Development Agency, if you observe any reactions after vaccination, you should contact the disease surveillance and notification officer whose phone number should be on your vaccination card or report to your healthcare provider. While the mass vaccination continues across the country, and Dr. Shalom Oni, a public health physician, tells us his experience in Lagos. Welcome to the program.
Thank you very much.
All right, so what's the major side effects that perhaps you've heard of, you've come across during vaccination in Lagos?
Severe tiredness, fatigue, body weakness, fever, temperature running up to 38 degrees or more, inability to walk or do individuals' normal daily routines. So
that sounds a bit extreme.
It's extreme, exactly. In fact, in some cases, require admission, for observation. But by and large, there hasn't been any mortality, from COVID-19 vaccination or adverse effect following immunization in Nigeria. So I think we can put our trust, our confidence in that side effects will occur, but then it's just ends and being mild, moderate.
When you look at the progress of the states, Lagos State, for example, do you think that they're doing well so far?
Well, Lagos has been the epicenter, and from the first day, they hit the ground running in terms of testing, in terms of mobilization, in terms of putting structures and organization in place. So, and even till COVID-19 vaccination. So, for me, Lagos has been doing well. By and large, I think in the second phase, in second dose vaccination, I think some degree of effort, need to be put in place. There's ongoing mass vaccination. There's also mobile vaccination teams out there. But I think we now need to look at a strategy, in making sure that we scale up the percentage of eligible persons that are vaccinated in Lagos State, especially for second dose. So
perhaps one can tie in that if you've received the first dose and some of the adverse effects you've mentioned, the side effects, they get that. They probably think they will get that during the second dose, and so they stay back. That could definitely be affecting the numbers.
Well, as at 2 days ago, someone was interacting with me and said, my wife took the second dose, man, and things like that. So that could, in a way, affect, the person in question has not received his second dose. So that could, in a way, make him to lay back and say, well, maybe I should delay mine. After all, I'm okay. I don't even have any sign that I have COVID-19 and things like that. So the knowledge, the occurrence of adverse effect following immunization sure plays its own role, in vaccine hesitancy. But beyond that, we want to look at the issue of risk communication, vaccine effectiveness, and every other thing that has to do with COVID-19 vaccination. We need to continue to do that. It's like, a lot of engagement in community, is non-existent. So I think the government needs to come out, by and large, WHO and also MPHCDA have also said that one of the things that is responsible for vaccine hesitancy is disinformation and lack of communication, proper communication. So we need to go back to the community, the political leaders, the community leaders, religious leaders, bring everybody on board, have town hall meetings now, so that we can scale up to that 70%, by the middle of the year. So I think that's what we should do in scaling up COVID-19 vaccination. So
today, the World Health Organization Africa region says if African countries are to reach 70%, of course we know it's just about 11% that has vaccinated so far, they need to increase pace of rollout sixfold.
Times. Yes. Now, if you hear sixfold, you think, oh, in terms of pace. But let's be more specific. What does that mean? That means that what you have been doing, or all that is required to ensure that there is vaccine uptake, do it 6 times. Let me start from the issue of communication, to the community. Let's be more aggressive. Let's communicate more. Sometimes when you listen to radios, and you hardly find people the jingles anymore. about COVID-19 vaccination. So let's go out there to the community, to the key figures, the informants, the leaders there. Let's engage them in town hall meetings. That's number two. Number two, even the availability of vaccine, let it be more available 6 times than ever before. Sometimes you see the videos making a call. I say, do you have Moderna? I say, no, sorry, Moderna is not available today. Come next week. No, that shouldn't be happening anymore. Moderna, Pfizer, AstraZeneca, everything should be available. Come. In fact, the vaccine should be waiting for you, not you waiting for vaccine. A lot of people who are due for second dose, a lot of people are due for boosters, but they can't get it right now because of the change in schedule. So that's what it means. In terms of research, how much of research into vaccine production are we doing? Because that will also determine vaccine uptake. It has been discovered as that's one of the major hindrances to vaccine uptake. Our own local research, the answers to the local variants that we might be grappling with. So we should be funded, not paying lip service to that. Sometimes we like these the big things, out there. But going back to the micro aspect of COVID-19 vaccination, which I thought to be vaccine development in the laboratory, we need to fund that, because when you are producing locally, you don't need to start waiting for the ones that you are receiving from the COVAX. So that's another area. So we need to double up our efforts 6 times as far as research into vaccine production is concerned. Then the logistics for the distribution of vaccines. We don't have the cold chain yet. Let's ramp up our logistics chain 6 times. When we do this, then we can see that our vaccine uptake increase in Lagos and in Nigeria as a whole.
All right, we always appreciate your time on the program. Thank you so much, Dr. Shalom Muni, public health physician. Thanks for joining us.
It's my pleasure. Thank you.
We'll have more of the situation around the world when we return. Please stay with us. Welcome back. The World Health Organization's Europe director says the continent could soon enter a long period of tranquility in the COVID-19 pandemic. Dr. Hans Kluge cites high vaccination rates, the end of winter, and less severe nature of the Omicron variant. It comes as a number of European nations and COVID-19 restrictions. Dr. Kluge says some 12 million new virus cases were detected across Europe last week, the highest recorded. But officials have not seen a significant spike in those needing critical hospital care.
I wish to reiterate the firm call I made last week, which is indeed referring to a plausible endgame for the pandemic. Not to say that it is now all over, but to highlight that in the European region, there is a singular opportunity to take control of the transmission because of the congruence of 3 elements. First, a large capital of vaccine-derived and natural immunity by Omicron. Second, a favorable seasonality pause as we move out of the winter. And third, a lower severity of the Omicron variant, now well established. In the last quarter of 2021, there was a disruption in cancer care, screening and treatment of between 5 to 50% in all countries reporting. The situation has improved since the first quarter of last year, where services were disrupted by more than 50% in 44% of countries, and by between 5 to 50% in the rest. But the knock-on effect of this disruption will be felt for years.
Thank you. Oleg, Dr. Benesh.
And the U.S. CDC is making a national forecast predicting 7,600 to 23,700 new COVID-19 deaths, which it says will likely be reported during the week ending February 26, 2022. Well, let's find out more. Joining us right now, Dr. Adekunle Tometi, a clinical pharmacist. He joins us from Dallas, Texas. Thank you for joining us on the program.
Thank you very much.
We hear infections are coming down. We're seeing that in the United States. But what about the deaths?
Well, thank you very much for the opportunity. The death rate that we've seen, it's coming down, as well as hospitalizations have been coming down. When we look at, when we were last on this program, which was January the 20th, we were looking at a high occupancy rate in the hospitals where all the beds were filled up. But for now, we're seeing people being discharged. We've passed the Omicron peak. We are no longer at that place where we have no beds for people. In fact, in places like New York, infections rate in the community has dropped 90%. Same thing with a place like where I am here in Dallas, Texas, infections rate has dropped about 75%. So as more people are leaving the hospital, we're having less death. Also, we're seeing that the Omicron variant itself is not causing as much death as the previous Alpha and Delta variants, because what we'll find out with research is that the Omicron virus only affects the upper respiratory tract infection and not the lungs. So since it doesn't affect the lungs, deep down, people are able to manage this Omicron variant. They're less sick, and we have therapeutics to help take care of this. So because of this, we're seeing a whole lot less death amongst the population.
But even with that, the World Health Organization is saying it's premature for really any country to declare victory, saying it's still dangerous, and you know it continues to evolve, and it's monitoring even some sublineage of the Omicron variant.
Yeah, that is true. It's not time for anybody to declare victory. But when we go back to our basic immunology, there's something we call secondary immune response. A majority of the population have had their vaccines. I'll say in the state of Texas, for instance, we've seen 70% of people have done their first shot, 60% of the people have done their second shot. That's an increase from the last time we were here, where it was 60 and 50. And in the US, as a country, we're looking at 75% first shot, 60% second shot, because a lot of people have gotten their shots and they've gotten boosters as well. They are protected somehow against these COVID-19. What I was alluding to earlier about secondary immune response is most people have had a bout of Omicron or a bout of the COVID-19 infection. Somehow they have antibodies within them. A lot of people have had their vaccines, those who believe in science, they also have some antibodies in them. So if there's another wave that's coming right now about any new variant of COVID, it is assumed that a lot of people, most of the population now have antibodies against the virus, but still, we will not stop from asking people to continue to follow public health advice, continue to, if they can, wear their mask, stay 6 feet away from people, wash their hands, and assure that they don't gather too much in crowds.
But Dr. Temeti, if that assumption is correct with the antibodies that have developed, I mean, that's part of the arguments for the anti-vaxxers, saying that there doesn't need to be a vaccine mandate.
I would not say that there should be or there shouldn't be a vaccine mandate. After all, when you buy your car, you drive your car, nobody asks you to get insurance, you must get insurance. Somehow it is important that we encourage people, that there are opportunities and avenues for them to get their vaccines. It's a beautiful thing here in the United States that vaccines are free, and the government has stocked a lot of outlets for people to get their vaccines. Pharmacies are everywhere, within 1-2 miles to people's homes, people's work, so they can always go there and get their vaccines. If they choose not to get a vaccine, over here people have a lot of rights, so we cannot force people to get vaccines. Well, vaccines have been shown to be one of the very important way and method of trying to control and win this battle against COVID-19.
We appreciate your time on the program. Thank you so much, clinical pharmacist Dr. Adekunle Temeti, joining us from Texas. Thank you for joining us on the program.
Thank you, Ms. Millicent. Bye-bye.
Goodbye. And now to the global updates. Let's find out what's happening in the rest of the world.
Malaysia on Thursday kicked off a COVID-19 mass vaccination program for children aged between 5 and 11 in a bid to protect some of the youngest members of its population.
I think it's a great move to get the kids that have not been vaccinated up until now to undergo this vaccination process, because it is good for them in order for them to be protected against the COVID-19 virus, and in doing so, it is also protecting the public at large. So it's a good thing.
About 517,000 children have been registered to take the Pfizer-BioNTech vaccine as of Wednesday, according to local media, which quoted Health Minister Khiari Jamaluddin. Malaysia Health Ministry says in the past 6 months, 147,282 children aged between 5 to 12 have contracted COVID-19, while the total number of deaths across all ages was 26.
Today I want to talk about the next set of changes.
New Zealand has announced a phased reopening of its border that has been largely closed for 2 years due to the coronavirus pandemic, as the government has tried to keep the coronavirus out. Prime Minister Jacinda Ardern says vaccinated New Zealanders in Australia can travel home from February the 27th without requiring to isolate at state quarantine facilities, while New Zealand citizens in the rest of the world will be able to do so 2 weeks later.
Today I'm announcing that the fully vaccinated Kiwis and other currently eligible travellers from Australia will be able to travel to New Zealand from 11:59 p.m. Sunday, 27 February. And instead of going into MIQ, will be able to self-isolate. And step 2, just 2 weeks later, fully vaccinated New Zealanders and other currently eligible travellers from the rest of the world will also be able to travel into New Zealand without going through MIQ.
Tourists from Australia and other visa-free countries will not be allowed to enter until July, and travellers from the rest of the world will be kept out until October under the plan, which will also require them to self-isolate on arrival.
Our website has more updates and a better understanding of the pandemic. Plus, you can find other stories at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.